Welcome, and thank you for taking a minute to be with us today. I understand your time is valuable and hope that the exchange of information that we give today will be worth your time and effort. Certainly we're excited about it. We think that this information is amazing and hopefully will be life-changing, but I guess time will tell, and hopefully that's the case. Exciting information that's out there, exciting research and technology and opportunities to help patients, and that's super exciting to me. And I'm hoping that, again, you find this information valuable. Maybe it's for you, maybe it's for a family member, maybe it's for a friend. But again, I appreciate the fact that you're here with us today. With that in mind, I want to talk a little bit about migraines. Let's jump into this topic by discussing a little bit about what migraines are, and then also a little bit about who they affect. So the first thing to understand and to really bring to light is the fact that migraines are severely debilitating. They are life-altering. There's no other way to put it. They are absolutely life-altering. If you've experienced migraines yourself, you understand this. For a lot of the rest of us, we just don't get it. And that can be hard. And so part of understanding a migraine means that you need to know what it's about, and whether it's the fact that you weren't able to attend a party, or you missed out on a great event for your child, or you weren't able to go to work, or whatever. Migraines are absolutely life-shaping, and not in a positive way. Sometimes it's just the matter of fact that you hurt so much, and you find yourself in the room alone, in the dark, crying, trying to figure out, why me? What did I do? How did I set this off? And the thousands of questions that come because you're so uncomfortable you can't see anything else. You're in that kind of pain. You can only focus on that and what's right in front of you, and you don't see an end to the pain, and you don't see the end to the crisis that you're currently in. It's absolutely disabling. It's disabling physically, emotionally. It disables your family. It disables your friends, events, anything that you had planned, that life that you had, the structure that you were hoping to fulfill. It's gone, and so it's super challenging. It's difficult. It's nothing more than disabling. That's what it is. Well, migraines, and we have a lot of different descriptions for them, certainly. I think understanding how broad they are, and then understanding what they are and what sets them apart from just a headache is very important. So just some very, very blunt statistics, if you will. 85% of chronic migraine sufferers are women. And that can be very significant, especially if you're looking and correlating that to cycle, to period time. Certainly hormones are a very critical part of migraine and their formation. So not only do you have to deal with the uncomfortableness, if you will, of cramping and the discomfort of dealing with the flow and everything else that happens, but on top of that, occasionally you'll get a migraine. It can be, it's just amazing how disabling this is. Migraines affect 28 million people in the United States. That's not a small number, 28 million. Interestingly enough, before puberty, boys can actually get migraines, and that happens actually more so than girls. But after puberty, that shift happens, and it's often the estrogen, the hormone shift that happens that initiates the cycle that actually instigates those migraines. Also, an interesting fact is the fact that children can actually get migraines. We've been able to track migraines in children as young as 18 months. So a very significant problem that's affecting us. Most women that have migraines, they have more than one attack every month. And it's not uncommon to get attacks every week. It's not uncommon to have attacks that last a week. Again, these are very significant. We certainly have talked a little bit about the emotional cost, the time lost, if you will, of migraines, but understand migraines have a very significant financial impact as well. You're unable to go to work. You're unable to run those errands that someone has to take off work to do for you. You're unable to take care of your children. You're unable to do just some of those basics that really need to happen so your life can continue to function. And then add to that the fact that you've got additional expenses. You're seeing doctors and therapists and treatment for this and therapy for that and idea for this, and you're running all over the place. And so that's a further expense not only on your time, but also on your pocketbook. And it builds up over time. The fact is that chronic disease and or medical hardship is the number one reason why families have to declare bankruptcy in the United States. The number one reason. Now, I'm not saying migraines are the number one reason. Please listen to that very carefully. But migraines are a huge part of that. 28 million women are affected by that. Just women. How many, again, male sufferers? I mean, it just compounds and goes on and on and on. And then that repercussion throughout society is quite impactful. So finding something that can bring that all together is key, and finding something that brings all of the different triggers that you know about together is absolutely critical. It's super exciting and important that you do that. Okay? So the question is my headache, is it a migraine? Well, what sets, for providers, for physicians and practitioners, what sets migraines apart for us? Obviously the severity. That's a big component of having a migraine. But there are migraines that happen in patients that don't have headaches at all. And so putting a lot of those pieces together can be very important. Often migraine headaches, the sufferers will have dizziness, nausea, they'll have sensitivity to light, sensitivity to smell. Sounds can set everything off. Touch can be very aggravating, especially around the scalp. You can feel very depressed. You can have visual loss. There's even something called Todd's paralysis where migraine sufferers actually get complete loss of function of a portion of their body. So again, a very significant disease that has a lot of repercussions. A lot of different symptoms that can be going on, but the big key that we notice with a lot of patients that complain about migraines is the severity, and they are absolutely severe. They are debilitating. There are typically two types of migraines. There's episodic and chronic, and this really has to do with frequency. A lot of patients that have they actually measure migraines, if you will, in headache days per month. How many headache days do you have per month? And so tracking your headaches and understanding that can be very critical. And we'll talk a little bit more about that later. But understanding your headaches and the triggers and all those different things can be very important. Understand that your frequency and the time of the day and those type of things can be very important as well. What set that off? The reality is understanding and looking at those headaches in a different light, but also bringing all of those triggers together in a very central treatment protocol is key, and it's key to helping you get better. Okay? I want to just touch quickly again on some of the ways that you'll know if you are a migraine sufferer. With the understanding that we treat other types of headaches. I'm sorry, I know that this is a little bit of an aside, but there are a lot of other types of headaches, but we've really focused in on migraines. So migraine sufferers, we've talked about the scalp, we've talked about pain around the face, we've talked about vision problems, sound problems, nausea, dizziness. Did you also know that you can be so upset from your gastrointestinal system that you'll cramp? Some patients actually feel so irritated throughout the rest of their body they can't be touched, not just to the scalp. They'll have nasal congestion, they'll have irritation. The pain can be dull, it can be sharp, it can be very focused, it can be in one particular area. It can be diffused throughout the brain, it can be behind the eye, behind the ear. There's a lot of different things that may point to the fact that you are having a migraine headache. So again, the question is, why can I have all of these symptoms and it have one specific label, that of a migraine? And what we're really bringing together is an understanding of the interconnectivity of the body. So why is my scalp sensitive? Why does sound set this off? Why is there pain behind my eyes? Why does light set it off? Why are all of these symptoms going on? And again, being able to bring all that together, the connection between the vagus nerve and what we call the sphenopalatine ganglia, my apologies. Understanding how the hormones affect blood flow and how it affects the inflammation and irritability of those nerves. Frankly, how it makes those nerves more active or less active. How certain triggers, be that food allergies or environmental allergies, how do those play a role and what's going on? Well, again, the excitement about what brings that all together is understanding that for 80% of of migraine sufferers, that deals with something called the sphenopalatine ganglia. Now, if you couple that with an understanding of tension, arthritis, TMJ, and some of those things, again, treatment becomes not only clear, but possible. I want to emphasize the importance of really building a team, of being together as far as getting you well. We've alluded to a little bit to the fact of mindset and those type of things, and we need to talk a little bit about where you want to go and understand the importance of never giving up. I think one of the hard things about migraines is the fact that it is so debilitating. It is so challenging. It changes and alters your life so much that it becomes depressing. It seems almost overwhelming. And hopefully you've built a team, if you will, of people who support you, not enable, support you, and help you through this, and really make it so that you're looking and consistently struggling for that answer, if you will, the ability to get well and get better. Well, part of that has to do with your mindset. You need to decide where you want to go and how you want to get there. You know, we've had patients come in and say, gosh, if I could just get 80% relief, I'd be thrilled. Some 60%, and most just want to get well. And that's where we're at Denali. We want to help you, but you've got to decide where you want to go. Now, that's not set in stone. Certainly we've had patients come in and say, man, if you could just cut my headaches in half, I'd be thrilled. And then we get halfway there and they're like, okay, let's go all the way. That's exciting. That's fun, because we opened their eyes to the possibility of living life differently, not debilitated, not held captive, not trapped by migraine headaches. So building that team, building that system, if you will, that process that helps you get better is key. And I want to emphasize the fact that you are the pivotal point to that. So many times we want to push it aside or say, okay, someone else take care of this, or that didn't cure me, or that didn't fix me, or those kind of things. You're the key. You have to be the key. You have to decide what your goal is. You have to decide never to give up. And then one of the most key and important things that you have to do is you have to start creating what's called a journal. You have to track everything that happens with your headaches. Everything. When did it happen? When did it start? What time of day? Where am I at in my period cycle? Where am I at as far as my stress? What were my stressors? Triggers, foods, medications. Did I get enough sleep? Did I eat chocolate, salami, onions, cheese? Did I have too much dairy? I mean, all of these different things. Too salty, not salty enough. All of these little components are very critical. And having that journal where you keep track of all of that is very helpful. And again, pulling all that together in something that makes sense so that we can treat you and help you get better. Okay? I cannot emphasize a journal enough. It helps you in your mindset. It helps you deal with the reality of how debilitating this is. You can write down what you weren't able to do and how frustrating it is. That's powerful, believe it or not. Making that real to you and then deciding that you're going to get over it. You've got to make all of these things real, but pull that all together in a journal, okay? Excuse me for just a second here. Now, as you get an understanding of the fact that you are the key, you're the keystone, the linchpin, the whatever you want to look, however you want to look at this, you're the cog that makes it spin. Part of that process is understanding that your body is amazing. And the body is designed to heal in all phases and in all ages of life. It just needs the proper building blocks, nutrients, and the environment to do so. Some of that environment we create by having a right mindset. Some of it we create by putting the right nutrients into our body. And some of it we create by just understanding that this whole process is that. It's a process. It's a journey. It's a path that you're going down. If you think back and consider where your life has come and what has brought you to this point, you'll realize that the things that really mattered, the things that made a true difference in your life, weren't just a flash in the pan. It wasn't just a single spark. Certainly those things can be important to move you down towards the healing process. And it's often that final thing that we pay the most attention to, but in nearly every case, and certainly every case that I can think of as far as where true value, true healing, and true change occurs, it is a process. It is an event. So you've got to wrap your head around the fact that you're not looking for this single event in time to change this multifactorial, this multifaceted disease and change it overnight. It's to do so would be merely actually covering it up, and that's what a lot of treatments look at, is they just try to cover it up, push it to the side, and the reality is it just grows, it gets bigger, and you have to deal with it later. We know that happens in life, and I'm here to tell you it happens in your health as well. Deal with the problem, fix it at the root source, fix it at what's really causing the issue, and then you're able to move on. Okay? All right. There are three key components, three key things that will actually make a huge difference as far as getting you well. Headache is a pain. It's a perception of something that's not right in your brain, and that information has to get to your brain through neural connections, if you will. So again, we've talked about the fact that this could be foods. It definitely is related to hormones and foods and blood flow and all of the things that you've heard in your life about what causes headaches and what causes migraines. Yes, it's probably right. And a lot of that, if not most of it, all comes together in you being able to make some very slight changes, if you will, but significant changes. And then us being able to help your body reset, heal, and grow. Excuse me. And And it's bringing those therapies together in a unique way that, again, is very powerful. So the first thing that I'm going to talk about is something called a migraine reset. What is a migraine reset and why is it important? Well, a migraine reset has to do with this phenolpalatine ganglia. A ganglia is a collection of nerves, if you will. It's where nerves in your body all come together to kind of mesh information, if you will, put it together, and then distribute it to where it needs to go. If you will, they're kind of like micro brains. They really are. And oftentimes when we get migraines and we get headaches or experience things that aren't quite right, it has to do with miscommunication, inflammation, irritation that surrounds that hub, if you will. And with a lot of the research that's going on, we're finding that that's the case with the phenolpalatine. This phenolpalatine ganglia is a collection of nerves that sits right behind your nose, and it is in control, if you will, or receives input from a lot of different places, be that your GI system, hormones, blood vessels, your vision, certainly smell. All of those things play a critical role. Well, this ganglia sits within a very narrow strip of tissue. It's surrounded partially by bone, and the other is fibrous, and it's very strict. It's very narrow as far as the gap that it has to do its job, and its job is very important. We know that tissues in the body, when they do work, they have to bring in nutrients, they create energy from those nutrients, and then they have to expel waste. That process causes a little bit of swelling and fullness to that tissue. Well, this poor phenolpalatine, and especially we're finding in, again, a huge number of migraine sufferers, doesn't have the room to do its job because of ongoing inflammation, irritation, and irritability. So there's more proteins, there's more swelling, there's more irritation that has that already swollen to the point of fullness in its tiny little gap. So the process of a phenolpalatine reset is getting into that tissue with nutrients and chemicals and the appropriate location in order to get that nerve the space that it needs. And I got to tell you, as crazy as that sounds, maybe as simple as that sounds, it's not any more complicated than that. We need to get in and allow that nerve to do its job, that ganglia, that collection of nerves. We need to allow it to do its job. And to do that, it's a very simple process. That process, and again, this is an FDA-approved process, involves you coming into the office. Certainly we'll have an intake and an exam and those type of things. And then to do the actual phenolpalatine just is simply laying on your back. We put you in a certain position. The provider will numb up your nose with a spray. So again, nothing uncomfortable there. Then using a small, soft, very flexible catheter, we insert this small catheter, which is nothing more than a tube, up into the upper reaches of your nose, something we call the upper turbinate. That upper turbinate is very unique in the fact that it allows us to put medication back there, and your body will allow it to sit there and absorb rather than draining down your throat. Now, understand that during some of your treatment, you may get some down your throat, and that's perfectly okay. But getting it up to that nutrient, that pocket, if you will, is very critical. So we put the nutrients in, and then we allow it to sit and absorb. That phenolpalatine ganglia has a set of nerves that's sitting right in that upper turbinate area. And so it absorbs those, and that allows us to reset that nerve. I know you're thinking that a reset sounds like it's this hard and fast and immediate process, and to some degree it is. But understand it's very similar to peeling back the layers of an onion. And so in most cases, we're looking at 3 to 5 treatments. If you've had this going on for years, we may be looking at something perhaps even a little longer than that. But understand that with each, and it may take us a few treatments to actually get the process kick-started, but in most cases, you notice a significant difference very quickly. And then it's just a matter of continuing the process and moving it forward. You'll rest for about 20 minutes while the nerve and the medication is absorbed. The nerve will reset over the next period of minutes, and then away you go. Back to your normal life and back to doing the things that you should. Now, we have patients that come in at a variety of different times. Don't think that the only time you can be treated is when you have a migraine headache. In fact, most of our patients come in when they don't have headaches. And this can actually be helpful in that you're not dealing with the acute inflammation, the immediate inflammation that's going on during the headache. So we can treat both. Don't feel like timing is critical, that you have to be ongoing and having a headache at that time. In fact, it's very effective at both and can be more effective when you're not having a headache. One of the other key components as far as getting well from headaches is to understand the tension and the tightness and the irritation that can occur, be that from stressors or from just muscle spasm and irritation. And the tensions of life, that can come from a variety of different sources. In most patients that have headaches, that shows up in two key locations, and that's either their neck, so the cervical area, or it's in their temporal mandibular joint. Well, there is a very direct and precise way to reset these tissues as well. And this is a process that uses what we call Renew-O2. Renew-O2 is a process of getting very precision delivered oxygen, ozone, and nutrients into the tissues that need to decrease their inflammation and heal. And again, over a long period of time, be that TMJ, your neck, or what have you, the likelihood that you've built up a little bit of arthritis, certainly some inflammation, that all needs to be dealt with. And we put the good things that your body needs to deal with that into the tissue and let the body do the miracle. Finally, one of the last things I want to talk about is the value of making sure that you have adequate nutrients throughout your body, and also that you have adequate hydration. So you're keeping your journal, you're writing down how much you're drinking and what you're drinking and the nutrients that you're taking and things that set you off. And then coupled with this, understand that you may need and have significant benefit from getting an IV infusion of fluids and nutrients. Now you think, why would this be important? Well, we've talked about the fact that often migraines can be triggered from combinations throughout the body. And when the body's irritated, it will send these signals back to the brain that has to deal with it, and then it sets off this cascade. And we want to use that very same cascade, but in an opposite way, which is provide the body what it needs, the vitamins, minerals, nutrients, and building blocks that it needs to do well and to be healthy, so that those bad signals aren't coming, just so good signals are coming. The other thing to keep in mind is that 97% of Americans do not get adequate nutrition from diet alone. That means 3% of us get adequate nutrition from diet alone. The rest of us either need supplementation or IV nutrient delivery. The nice thing about the IV nutrient delivery is just that. If we give a gram of vitamin C, a full gram of vitamin C is delivered to your body ready to be used. It doesn't have to pass through the liver. It doesn't have to wait to be absorbed. It doesn't get blocked by other foods, nutrients or otherwise. It gets right into your tissue and it's ready to be used. So it can be very critical as far as one of those final pieces is putting together your wellness. Certainly this has been a lot of information. It's been I'm hoping not too much to understand, and I'm hoping we kind of gave a good flow for you to understand. Certainly, we understand there might be some additional questions or how this may pertain to you. And if that's the case, we welcome your questions. We welcome you to either give us a call, comment below. We have people available to answer your comments. Additionally, we'll be answering more questions every Wednesday at 12:30 on Facebook with our Ask a Doc program, and you're welcome to tune into that and see if there's ways that we can help you. I really look forward to being able to help you get well, recover your life, get your life back, regain those valuable experiences with your family, and move forward. And I hope you allow us to be a part of your journey to wellness.